Hello there. My name is Travis Broadbeck, and I work at CARES in New York Inc. as the Operations Technology Specialist. Thank you for joining us today, and welcome to the presentation. We'll be investigating signs of racial disparity in the community by analyzing data entered into HMIS between 2018 and 2020. Let's go ahead and get started by covering the expectations for today's presentation. In just a moment, we'll cover the methodology. But before we do that, let's cover the expectations for today. Today is just the starting point, and our goal is very big and important. Our objective is to come to an agreement with what the current status is of the community. Imagine this like the state of the COC address. We're taking the first step in understanding where we are. And after today's session, we want to start asking specific and pointed questions that will drive lasting change in our community. And by investigating these questions and learning more about the patterns in the data, we'll be able to recommend process improvements and also invest more resources in improving the community's operations. Today's analysis was calculated using HMIS data between 2018 and 2020. We removed any clients that had incomplete race data. We also removed any clients that had an age that was less than 0 or greater than 109 years of age. And we're looking at data by the calendar year and not the HUD fiscal year. So let's go ahead and talk about the executive summary. The key points that we want to cover today is the fact that we do see an overrepresentation of Black or African American clients in the homeless system. The way we see that is we compare the total proportion of clients that are in the HMIS between 2018 and 2020, and we compare that to both the census population and also the American Community Survey poverty population. In both cases, we have at least an overrepresentation of Black or African American clients in the homeless system by at least 3 to 1. The other points we want to include is the fact that our emergency shelter programs, followed by services only projects, were the most admissions. So when we think about the majority of our records that we're going to look at today, think about those project types, and we'll see more of those explorations as well. We also see a pretty large growth in HMIS admissions with the coordinated entry program, especially when we look into 2020, but comparing it to 2018, there is immense growth. And lastly, we do see the lowest amount of data from COVID-19, and we'll talk about some of the caveats that comes with it. Tying back to our first point from the executive summary, this visualization compares the HMIS admissions between 2018 and 2020 on the left side, the census population for the continuum of care in the middle, and the American Community Survey 2017 poverty population for the continuum of care on the right. And what we can see here is although white clients make up more than 90% of the community's population and more than 85% of the community's poverty population, we see that 12% of all HMIS admissions were from clients who are Black or African American. So whether you compare this 12% to the 4% census population or the 3% poverty population, we can conclude that there is an overrepresentation of Black or African American clients in the homeless system. Now, one thing I do want to note here is we're seeing folks come to our doors, so we're not really seeing any data of what drove them into homelessness. We're actually dealing with the impact of systemic racism and other barriers that have drove these clients into homelessness and entered our system. So we may not be able to address all those factors, but when they're at our doorstep, how can we best understand the data and improve our operations so we can lower recidivism and serve the most vulnerable folks first? So here is some context when we look at the HMIS data by race. And we're seeing this as the 2018 to 2020 HMIS admissions. And we're seeing the total counts of client admissions by race. Now, when we talk about client admissions, we're talking about total admissions. So folks went to a program more than 3 times across the 3 years, we'll see them 3 times in the data. Because we're considering admissions as when someone shows up at the door, is entered in HMIS, and starts receiving services. So they are using the community's resources. So we want to address the utilization of resources. And what you can see here, we have a pretty sizable proportion of clients who are Black or African American, and clients who are 2 or more races when we compare to the overall white population. Tying back to one of our points from the executive summary, we're looking at the total admission records year over year in this visualization. And what we can see is that the number of total admissions recorded in HMIS decreased greatly between 2019 and 2020, The decrease was so great that it was actually lower than 2018 admissions, when we had fewer counties inside the continuum of care. Now, the reason we want to address this caveat and the impact of COVID-19 on our data both now and later is the fact that we know that there were clients who may have not sought services due to the pandemic. We know that some programs had to reduce their capacity and able to meet social distancing requirements. And we also know that other programs like the eviction moratorium and other stimulus options had made the need for some of our program types to go down, for example, homeless prevention. So with all these factors at play, we want to call this out and recognize that the data in 2020 is skewed, and it will also impact how we look at the data in future years as well. And one thing we also want to call out is the fact that there is a lot of academic and community research that says that the pandemic was much worse for communities of color. And now that we have that fact in mind, and we know that we didn't collect all the data that could have been collected, we know that we do not have the full picture. Therefore, we need to keep our mind open to the data that we don't have here. In this visualization, we're looking at the year-over-year admissions by race. And the one thing we can see is that the share of Black or African American clients increased from 11% in 2018 and 2019 to 16% of total admissions in the year. This is significant and something for us to notice in this spike, where we saw fewer admissions in 2020, but we saw a higher proportion of Black or African American clients. In this chart, we can see the total number of admissions into HMIS between 2018 and 2020. Once again, we're tying back to our executive summary finding, where we found that the emergency shelter program and the services only program make up 3/4 of total admissions across the 3 years in the HMIS records. In an effort to explore the previous visualization more, we see that year over year, the proportion of HMIS admissions followed a mostly consistent pattern, with 3 exceptions. First, coordinated entry admissions grew immensely in 2020. Second, services-only programs declined in admissions year over year, with the greatest decline happening in 2020. And lastly, rapid rehousing programs experienced a spike in new admissions in 2019 that does not follow the pattern seen in 2018 or 2020. In this visualization, we're exploring just the street outreach project admissions between each year, 2018, 2019, and 2020 by race. Now, the one thing that really sticks out to us is even though we have a very small sample size of 128 admissions across the 3 years, one thing that is interesting to us, although may not be significant based on how many clients you're talking about, is the fact that the percentage of total admissions in 2018, 2019, 2020 had a different share of Black or African American clients. For example, in 2018, the total share of clients that were Black or African American admitted into street outreach program were 6% of clients. Whereas in 2019 and 2020, the percentage of clients that were Black or African American in those new admissions were 18%. In this chart, we're looking at homeless prevention program admissions. And what we can see is, although new admissions decline year over year, we do see a greater share of Black or African American clients being admitted into the homeless prevention programs in each year as well. In this visualization, we're looking at programs that only provide services only. And what we can see in this chart is the fact that year over year, admissions across all race and demographic categories decline proportionally, with one exception, and that would be the American Indian and Alaska Native clients, that we saw a major decline between 2018 and 2019, and a much smaller decline in 2019 to 2020. In this chart, we're looking at emergency shelter admissions. And one interesting observation is the decrease in total admissions in 2020, but at the same time, we're seeing a simultaneous increase in the number of Black or African American clients being served in emergency shelters through new admissions. So we're seeing a greater share of Black or African American clients, although there is a total decline in new admissions. Now we're changing our attention to coordinated entry admissions. We can see that we had very few admissions in 2018 and 2019. We had a pretty large spike in 2020. That's probably driven by a new program coming online or a new procedure or practice happening in the community. Now, one thing we do see is a sharper increase in clients that are Black or African American or two or more races in 2020, but nothing too significant that jumps out at us yet. Now we're looking at rapid rehousing emissions between 2018, 2019, and 2020 in HMIS. The main point of interest is the spike in total emissions in 2019, most likely brought on by a new project type being added or a greater demand overall. Now 2020, we do see a decrease in total emissions, most likely brought on by the pandemic with the eviction moratorium and other issues and variables already discussed. So the most significant thing we want to call out is the fact that the proportion of Black or African American clients and clients that identify as two or more races changed quite a bit across the 3 years. So starting with Black or African American clients, in 2018 the share is 9% of total emissions were Black. In 2020 it's 16% of total emissions were Black or African American clients. And in 2020 it was 19% of total emissions were Black or African American clients. So from 9 to 16 to 19%. Now for two or more races, we see an opposite effect. We actually see a decline. We see that 17% of all emissions in 2018 were clients of two or more races. In 2019, we see 3% of all emissions were clients of two or more races. And in 2020, we see 0% of client emissions were of clients of two or more races. So just seeing these two changes in demographics just makes us consider what possibly happened here, whether it was a different population being served or a different way of entering data and different data quality standards. Now we're looking at permit support and housing admissions in the community. And some things that we see here is the fact that the share of Black or African American admissions into the permit support and housing program type across the 3 years had gone up between 2018 and 2019 and slightly between 2019 and 2020. So 6% of total emissions in permit support and housing in 2018 were of clients that are Black or African American. That more than doubled in 2019 with 14% of all admissions of clients of Black or African American. And 2020 it slightly went up with 16% of total clients being Black or African American. Otherwise, what we do see year over year is a decrease in clients of two or more races, which is another question of data quality or a change in the population that we're serving. We'll now look at 3 final visualizations before we wrap up. First, we're going to look at the interaction between race and gender, race and veteran status, and then race and disabling condition. In this visualization, we are dissecting the interaction between race and gender. The first point I want to draw our attention to is the fact that we serve significantly more males than we serve females. So that may be very useful to the community that is trying to figure out where to invest their resources, whether into male housing, family housing, etc. Another point to notice is of our non-binary and transgender clients, the overwhelming majority of them are white. Now in this visualization, we're looking at the intersection between race and veteran status. We can see from this visualization that we're looking at a total population of 6,821 client admissions. And of all those admissions, we have less than 350 veterans. And of those veterans, 81% of them are white. The reason that we want to look into this further is we want to make sure that the community is asking this question properly and asking appropriate follow-up. At times, clients may not identify as a veteran if they are possibly in a National Guard rather than the United States Army or Air Force. They may have had a dishonorable discharge, or they may have not served active duty, for example. Those are all 3 possible confusions that would cause a client to say maybe they're not a veteran. So the more that we probe in these questions, the more information we can get, because if clients are classified as a veteran, we can offer them more program offerings, therefore best treating them with more resources. In this visualization, we're looking at a total population of 6,325 client admission records, and we're comparing race and disabling condition. Now what we can see is of all the clients with a documented disabling condition, 84% of those clients are white. And the reason that we want to investigate this is because we know there is ample academic and community research that states that communities of color have less access to quality medical services. Now the reason for that could be a variety of variables.
such as the potential impact of stigma when we think about mental illness and substance abuse. We can also think about the lack of access to a medical system, whether it's because of transportation or lack of insurance, and other variables such as having a past bad experience and being more reluctant to see a healthcare professional. All of these are possible reasons why our disabling condition could be investigated further. So therefore, the community could partner with a county organization, such as the mental health office, and maybe have a mental health specialist on call or a substance abuse specialist on call to be able to do on-site documentation for clients in order to make them more eligible for other program offerings, such as permit-supported housing. And that concludes our presentation for today. I want to thank you so much for your time and attention, and I really look forward to your feedback and your questions. If you're curious about where we received the data for today's presentation, we collected our HMIS data from awards. We also collected our American Community Survey data from the HUD Exchange, and we collected our census data from the United States Census Bureau. Thank you so much, and I hope you have a wonderful day.